Chapter 2. Fundamentals of Marmacikitsa. Abad Havarjanam Nityas Vastav Nivardhanam Utpanardavigataska Marmam Parapalanam. Karakasamata Siddhisthana Trimarmaya Siddhi. The protection of vital parts consists of avoidance of impending factors, observance of the code of conduct for the healthy and remedy of the disorder if arisen. Marmacikitsa is also based on the same fundamental principles as Ayurveda. These include the Pankamahabhuta Siddhanta, the Agniomya principle in general and specifically, the principles of management of Veda and those of Rana-Sikitsa, Bhagna-Sikitsa. Anatomical, philosophical Marmacikitsa. Physiological and considerations in. The word marma is formed from three syllables, ma, ar and ma. Ra symbolizes Agni or fire and ma symbolizes the soma or moon. Thus the word marma means sites where the Agni is ensheathed/enveloped or protected by the soma. According to Ayurveda, the body is a functional equilibrium of the three dosa, which are in turn the derivatives of Agni and Soma 10, the duality of hot and cold, which are balanced by the Vayu 11. The concept of marma is clearly described in almost all the classical literature of Ayurveda. The main differentiating factor between the living and a dead body is the presence or the absence of the life force which is called as pra. This prana is the resultant of the ojas, which is in turn the essence of 7 Acharya Priyavrata Sharma. Charaka Samhita with English translation. 4th edition. Varanasi Chokamba Orientalia, 1998. * Ra. Pum, Rithi Urdvam Gadakiti Ra Da 1, Vaka Tixna Idamadini, Sabdakalpadruma. Mab, Pum, Mati Nirmati Jagadaiti Makab, Siva Kandram Brahma Itiekarakoa, Sabdakalpadruma, Viriam Dvividamusnam Sitam Ca, Agniyomayat Jagata, Sisruta Samata Sutrasthanam Dravire Sagunavaryavapakavihnani Yamadhaya. 10 Taka. Ya. 1. Somamarita Jamsi Rajasatvatamsi Ca Marmesu Praya Pumsam Butatma Kavatistate, Sisruta Samata Sararasthanam Pratyekamarmani Rudesa Saramadhaya. The dhatu, which in turn is the resultant of the anna, food. This pra, even though present throughout the body, is more specifically concentrated at certain locations of the body resulting in injury to these sites resulting in greater chances of fatality. Such points, which can cause death when injured are called as marma. Thus the knowledge of marma is important in the assessment of the prognosis of the disease. Diseases affecting the marma, or madhyamarogamarga where the marma are situated, are difficult to cure. 12-13. A Vaidya who understands the prana of the patient is called as a prakraya. The injury to marma need not result from an external injury, but may also be the result of an internal pathogenesis affecting the structures on or near the marma points. Thus, afflictions of marma may be classified into two, nija, due to dosabhigata, and agantu. The nija marmabhigata is mainly dealt under kayasakitsa using sadhana and samama methods, and the aganta marmabhigata is dealt under salya tantra using the principles of rasakits, bhagnasakitsa etc. Based on the extent of the injury, marma afflictions may be classified into two, i.e. marmapatapa, minor affliction, or marmopagata, severe affliction. Since the marma are located in the madhyamarogamarga, there is involvement of sira and snayu. The Sararasthana of Sisruta Samhita begins with the explanation of the origin of the creation. Sisruta states the philosophy of the Sankhya Darsana which describes the process of creation starting from the 12 Gambaram Bahudatastham Marmasandasa Masritam, Karakasamata Sutrasthanam Mahakatuspadodaya. Marmani Punarbasti Damardni, as Thisandeos Thizamaya Gastatro Anabadhaska Snayu Kandara, sa Madhyamo Ragamargal, Karakasamata Sutrasthanam Tisrazaniodayab. 1. Prakriti and Purusa to the buddhi, then Ahankara, and then the Pankatanmatra and finally the Mahabhuta on one side and the Ekadasa Indriya on the other side. Similarly, the Vedanta Darsana states that the living body is an integrated form of 5 planes or sheaths called as Pankakosa. The first among the 5 kosa is the visible structure of the body formed from the food which is made of dosa, dhatu, and mala called the Annamaya kosa. The second is the Pranamaya kosa, which consists of the prana or life force. The third is the Manomaya kosa, which is the level of the mind. The fourth is the Vijnanamaya kosa or the level of buddhi or intellect, and the fifth and final one is Anandamaya kosa, which is the Atma or the self. In this schema, the marma are located mainly in the Pramaya kosa, though being physically located in the physical body at the junction of mamsa, asthi, snayu, damani, sira and sandhi of the body, which thus becomes the adhisthana, substratum, for the marma. Thus the two classifications are two means of expressing the same truth. Identification of marma injury. The symptomatology of marma injury described in the Susruta Samhita as follows: 14 giddiness or dizziness. Excess talking / irrelevant speech / incoherent speech. Falling down, inability to stand upright. Fainting / confusion. Uncoordinated movements. Non-functioning of mind as in sleep. Feeling of warmth. Flexidity / laxity of body parts. Syncope / attacks of swooning. Upward movement of vayu, Udavarta. Severe breaking type of pain. Blood discharge resembling meat washings. Cessation of functioning of all the sense organs. Fatigue in mind and body. Apart from these general symptoms, the structure injured is a sira. The symptoms include 15. Profuse bleeding, occurrence of various diseases due to vata dosa. 14 Brahma pralapa patanam pramaho vicestanam samlayanus nate ca srastangata merkanamard vavitastifera rujov taktika ta with macron 34 mamzodakabam rudaram ca gashe sarvendriartha paramastathiva dasard hasan kiesvapi vixatisu samanyato marmesu lingamuktam 35, Susruta Samhita sutrasthanam astavadasastra yadhyaya. 35 Surendragopa Pradamam Prabhuddham Raktam Sravdvai Katataka Vyu Karoti Rogan Vividan Yathoktamskanasu Binasvathava Siresu. If the structure injured is a snayu, the symptoms includes deformities, weakness of various body parts, inability to perform various bodily activities, severe pain, delayed wound healing. If the structure injured is a sandhi, the symptoms include 17. Excessive swelling, severe pain, loss of physical strength or weakness. Breaking pain in small joints, swelling in small joints, loss of function of joint. Feeling as if joint is covered with on of barley / spicules, development of contractures, lameness or any other deformity on healing, loss of movements, dryness / wasting / emaciation. If the structure injured is a asthi, the symptoms include 18. Tremendous pain day and night. No relief in any position / posture. Thirst. Exhaustion or tiredness to body / inability to perform physical activities. Swelling. Pain. Discharge mixed with marrow. Clear discharge. Discharge having various colors. If the structure injured is a mamsa, the symptoms include 19. Profuse bleeding. Bleeding resembling washings of flesh pallor. Loss of sense. Death. 16 Kobjiam sartravaya vasta cryasvasacta stimula sirad vrano rohati yaja kapi tam snayavidham manujam vyavayasiat. 17 Sophativridha stimula rujaska balakaya parvasu badasafa. Ksatisu sandasvakala kalisu sayat sandhikarma paradiska lingam 18 Gora rujo yaja nisadanisu sarvas vavastasu na santarasti tringastaus vayathuska ruk ca tamasthivida manujam vyavayasiat. Rajaska. 19 Sparsam na janati vipandavarno yo mamsamarmania bittida sayat. Indirect references of application of concepts of MARMACIKITSA in Ayurveda. Even though there is a dearth of direct references to the use of marma points for healing in classical Ayurveda literature, there are numerous indirect references indicating that the knowledge of therapeutic use of marma points and Na with macron for therapeutic effect. Few such examples are as follows. Application of talum on the head during panchakarma procedures. It is a common practice during the various panchakarma procedures that a powder mixed in suitable oil or any other unctuous substance is placed over the vertex. This is done especially while doing the Svedana procedures which involve heating of the body. The application of talam is done over the adhipati marma, which is one of the most important sadhya prahara marma. Massage to soles of palm and soles of hands and feet and various other parts of the body which are marmasthana during the process of nasya karma. Point 20 in the procedure of nasya karma. After the installation of medicines in the nostril, it is described that the soles of hands and feet, shoulder etc. should be massaged. The sites described are the locations of the Taladaya marma of the hands and the feet and the Amsa marma. The mode of action of these is through the activation of the marmasthana. Another reference which shows the relation between the shoulder region and nasya karma is the indication for nasya karma in the management of avabhahuka. Some other examples of glimpses of principles of marma include tapping of the buttocks after the application of basti etc. If we look from the perspective of marma parapalanam or preventive aspects of marma, then various procedures described in Svastavtam such as abhyangam, especially Siroabhyangam, Wadram etc. are for the protection of the nearby marma points. Pumsavana Karma 21. While describing the procedure of Pumsavana, the differentiation between the right and the left halves of the body is clearly described. This shows that the concept of Iya with Makron and Pingla described in the yogic literature was well understood by Ayurveda, even though direct references to the Ida and Pingla Na with Makron not found in the Ayurveda literature. Similar. R. 20 Datameter 2 Nazi Karalaltakabite Migamaniaskandha Pipita Talanyanusam Mardayat, Astanga Samgraham Satrasthanam Naziavidab, Astangardayam Daksine Sinstvame Duhitravankia. 21. Putrartham Sararasthanam Garbhakrantaradya. References are also available in the later Ayurveda literature where it is described that the right side of the body is Pitta dominant and the left side is Kapha dominant. There are numerous other references available even in the Brihatrayi, such as formation of breast milk in left breast for female and right breast for male, prominence of left side of abdomen during pregnancy in case of female chili in right side in case of male child etc. 22. Similarly, it is advised that the female should enter the bed with her left leg and male with his right leg while going for conception. 23. All these references indirectly point to the Na system including the Ida and Pingla. Apart from these, if we observe various Vedic and cultural practices, there are numerous examples of the use of marma points in daily life. Few such examples are as follows. Anganayasa and Karanyasa done before rituals and before chanting of mantra help in stimulation of various marma points, e.g. stimulation of adhipati marma before chanting of various mantras while invoking the I of the mantra and stimulation of hridaya marma while invoking the devata of the mantra. Various traditional practices such as wearing of bindi or tilak of paste of sandalwood at the meeting point of the eyebrows, stapani marma, etc. Wearing of specific ornaments to protect various marma points such as crown for the protection of various marma of the head region such as samanta, adhipati etc., chest armors for protection of the marma of the chest such as apastamba, apalapa etc. Various yogic postures are designed so as to give pressure over specific marma points. E.g. stimulation of Nabhi marma during Mayurasana, adhipati marma during Sirsasana, etc. It is a common question as to why there is no chapter on MARMACIKITSA in Susruta Samhita even when there is a detailed chapter on description of marma points and their symptomatology. It is a fact that while describing marma, the primary focus of Susruta as a surgeon was to avoid injury to the marma points during surgery. Thus, Susruta has focused more on 22. Tatra. Yaja daksine stain prak payodarsanam bhafti daksinakuksamahatvam ca pervam ca daksinam sakthyat karsati bahilyaka punamadhyasu dravyesu dordamabahidhyati svapnizu kopalabate padmatpalekamutam ratakadani punamaniva prasanamukhavar ca bhafti tam bruyat putramium jana isiataiti, tadvapariyi kanyam, Susruta samhita sararasthanam garbhavakrantasaram. Tasya dakya persvadable, astangardayam. 23 Arrowhead Street 2 Vamina Sararasthanam Garbhavakrantaradhya.